I am guessing the vast majority of you out there have never heard of a molar pregnancy. That doesn't sound like something that should happen, right? And in really rare circumstances, it can actually implant inside your abdomen. But let me be very clear, no pregnancy in your fallopian tube or in the muscle of your uterus is going to be viable. So the things I want you to look out for if you're newly pregnant and you're worried that you might have an ectopic pregnancy, especially a tubal pregnancy, let me reassure those of you out there who are not experiencing loss that pregnancies, for the most part, are normal and healthy. Are you newly pregnant, coming up on your first ultrasound and wondering what to expect? Well, first of all, if this is a desired pregnancy, then congratulations. I hope everything is happy and healthy for you. And if you're someone who doesn't want to get bogged down with possible scary things that could happen during pregnancy, then this video might not be for you. And for those of you who've had any sort of pregnancy trauma, I encourage you to consider whether or not you want to watch this video because it can be triggering for some. But for those of you who think that more information is better, even if it might be a little bit scary, then in today's video, we're going to discuss 3 possible outcomes of first trimester ultrasounds that are really surprising and kind of abnormal that you might want to be prepared for. My name is Galloway. I'm a certified nurse midwife. I have been in this pregnancy world for a long time, and I have worked with many, many families who are newly pregnant and coming up on their first ultrasound and wondering what to expect. And sometimes you get really good news and it's super exciting and you find a very happy, healthy baby in there. And sometimes you get some hard news. And for me, I really like to prepare my patients for what they might find during that first trimester ultrasound in what feels like an otherwise normal and healthy pregnancy. The 3 things we'll talk about today are something called a blighted ovum or an anembryonic pregnancy, an ectopic pregnancy, and a molar pregnancy. So stay tuned for the rest of this video if you want to learn about those 3 molar pregnancies, especially I think are super crazy and interesting, and most of you probably haven't heard about them. So make sure to listen to the end so you can learn about those as well. So a blighted ovum, that's what those of us in this world call it for the most part. But I think the new terminology is an anembryonic pregnancy, meaning a pregnancy that doesn't have an embryo. So that doesn't sound like something that should happen, right? I think most of you think of your first trimester ultrasound and you think, if I make it that far, there's gonna be an embryo in there. There's gonna be a baby in there, right? But for some pregnancies, there is this mismatched fertilization between the egg and the sperm that creates a pregnancy without an embryo. And so early pregnancy, the way that it works is when you're newly pregnant, the first thing to develop inside your uterus is something called a gestational sac. And that's basically where the whole pregnancy starts. It's round, it's like this inside your uterus, and it's where the baby and everything else develops. So after you develop a gestational sac, then the next step is to develop something called the yolk sac, which if you think about like a chicken egg, it's like the yolk. And if a chicken egg is fertilized, then that yolk turns into a baby chicken, right? So that yolk, the yolk sac in a human pregnancy turns into an embryo and placenta usually. So that's the last thing that develops inside your uterus. But early on in pregnancy, if you're too early and we do an ultrasound, we may just see a gestational sac, or we may just see a gestational sac and a yolk sac. And that can actually be a normal finding in very early pregnancies. But when a pregnancy is further along, especially if you're about 7 or 8 weeks along, we should be seeing an embryo in there. And eventually that embryo also develops a heartbeat. So when you are supposed to be far enough along to have an embryo, and we do an ultrasound and we find no embryo in there, then we get concerned, right? So is this a blighted ovum, which is ultimately a miscarriage? Or is this just we're off on our dating a little bit? Maybe your periods were a bit irregular and maybe we weren't quite sure when your first day of your last period is, so we did our ultrasound a little too early. So if you have a blighted ovum, or if you have a pregnancy finding that does not show an embryo when we think it should, then your healthcare provider is going to talk to you about what might be going on. And some things they might do are have you get some blood tests to check your pregnancy hormone level and make sure it's rising. That's called an HCG level. And sometimes they might have you get another ultrasound. And sometimes, if we're 100% sure that you are definitely far enough along to have an embryo in there, or that gestational sac is measuring big enough that it should have an embryo in there, then they're going to diagnose you with a miscarriage. And then they're going to talk about the options of how to manage a miscarriage, which we'll go over in a different video. The second atypical pregnancy finding we're going to talk about today is ectopic pregnancy. A lot of you have probably heard about this, and most of you probably think of it as a tubal pregnancy. So a pregnancy that happens in the fallopian tube instead of inside the uterus. But ectopic pregnancy actually just means any pregnancy that is outside the uterus. It's not an intrauterine pregnancy. So that can happen in the tube. It can happen it can implant kind of in the muscle of the uterus instead of in the inside cavity of the uterus. And in really rare circumstances, it can actually implant inside your abdomen. Now, people who have ectopic pregnancies, anything besides an abdominal ectopic pregnancy, those pregnancies are considered non-viable. They will get to a point where the pregnancy is too big for the fallopian tube or for the muscle that it's being held in, and that area will break open. We call that a rupture. Ultimately, the baby will not survive that. And in fact, it can be very, very dangerous for you as a pregnant person. So I want to talk to you a little bit about signs of ectopic pregnancy, because sometimes they happen and we don't know they've happened because you start getting symptoms of it before you've actually had your first ultrasound. So the things I want you to look out for if you're newly pregnant and you're worried that you might have an ectopic pregnancy, especially a tubal pregnancy, are pain in your lower abdomen, pelvic area. A lot of times it's kind of one-sided, because if it's in a tube, then it's usually in either the right or the left tube. And so you might get really severe, sharp, one-sided pain, or it might be kind of diffuse, kind of all over your lower abdomen. And most women with ectopic pregnancy present with vaginal bleeding. At times, it can be very, very heavy. I think for some people out there, you get diagnosed with an ectopic pregnancy and your baby is still alive in there, and it is a super, super hard finding, because you see on an ultrasound that you have a living embryo, a living baby with a heartbeat. And for some people, you might be tempted to try to let the pregnancy progress because you don't want to abort your baby. But let me be very clear. No pregnancy in your fallopian tube or in the muscle of your uterus is going to be viable. It will never make it to the point of term. That's different for abdominal pregnancies. They're super rare, but sometimes those babies actually can make it to term, or at least make it to a viable age, which is crazy, but cool. But for the majority of ectopic pregnancies, they are life-threatening to you, because if that tube ruptures and it starts bleeding inside your abdomen, you could lose a lot of blood to the point where it threatens your life. Ectopic pregnancies are a little bit higher risk for some people, and the two populations that are at most significantly increased risk are those who had IVF pregnancy, and then also people who get pregnant with a progesterone IUD. So especially if you fall into one of these two categories and you're having what you think might be symptoms of an ectopic pregnancy, you need to get evaluated ASAP. Lastly, I want to get into something called a molar pregnancy. I am guessing the vast majority of you out there have never heard of a molar pregnancy, and that's because it's a really rare pregnancy finding. And a molar pregnancy is actually when instead of developing a full pregnancy with a healthy baby and things like that, we develop this benign mass or tumor inside our uterus that secretes pregnancy hormone. So it presents like a pregnancy. You get a lot of the pregnancy symptoms. In fact, people with molar pregnancies actually have an increased risk of something called hyperemesis, which is where you are just vomiting nonstop during a pregnancy. It can have all these pregnancy symptoms because it's secreting actually really high levels, higher than normal levels of HCG, that pregnancy hormone. But when we do an ultrasound, there's nothing but this mass inside your uterus, and it has this kind of Swiss cheese-like appearance, and then we, usually don't find a baby in there, and so that's kind of how we diagnose a molar pregnancy. It occurs because of a mismatched fertilization between an egg and a sperm, and just because you've had one molar pregnancy does not mean that you are at risk for another one. It's just a mismatch of that particular egg and sperm. But what you are at risk for of molar pregnancy, if you don't get it removed, is it actually can turn cancerous. So the tumor is benign to start, but it can become dangerous if left in for too long. So it can be something that's very important to find out. And that's one of the main reasons that we do early first trimester ultrasounds, because we want to make sure that we have a healthy, normal pregnancy. And molar pregnancies can be life-threatening. Now, some of the other symptoms you might get besides being really, really sick are you might have vaginal bleeding. That can come along with a million other things as well, but that can be one of the symptoms. You might get pelvic pain, and then your uterus is actually much larger than what it should be for a normal baby. So if you're 8 weeks along, then your uterus might be measuring the size of, say, a 16-week pregnancy. And that, as providers, kind of clues us into thinking, something might be going on here. It could be molar pregnancy, could be twins, and we should probably find that out too. But that kind of gives us a little bit of a clue on what we should be looking for on an ultrasound to make sure that we keep you safe. Molar pregnancies are really rare, and they're actually pretty complex. And this is just a very basic explanation of what they are and what we're looking for. And in fact, there can be two types of molar pregnancies, one of which is called a complete molar pregnancy, and it's just the benign mass. And then one of which you can actually have the mass and a baby in there, and those babies can survive. They do have more risk to the pregnancy, but that's something that can happen as well. You can have both at the same time. That's called a partial molar pregnancy. That's a whole other animal that we're not going to get into right now, but I think that molar pregnancies are something that people mostly haven't heard of or are worth talking about because they do happen. I will tell you, however, that for those of you out there who are, kind of going wild with this information, I've been doing this since 2012, and I've never seen a molar pregnancy, not in real life. I think I've had some patients that have, other providers in my clinic have seen that have had molar pregnancies, but I've never actually encountered one myself. And I've been doing this for a long time. So it is very rare, but it is actually a real possibility and worth mentioning. I know a lot of this sounds scary, and if you are out there and you're watching this video and you've ever experienced something like this, I would love for you to share your story with us. Let me support you, help me to encourage you in your loss, love on you a little bit. Loss in pregnancy is hard no matter what way you spin it. And for those of you out there who have lost kiddos, I am so sorry for your loss. If you want to share your stories, we'd love to hear from you. And while pregnancy loss is a thing, let me reassure those of you out there who are not experiencing loss that pregnancies, for the most part, are normal and healthy. And these findings, while they do happen, are uncommon. So the most likely scenario for you and your upcoming ultrasound appointment is that you're going to find a little baby in there with a heartbeat, and you're going to get to celebrate. And I'm happy for you. This is just the first video in a series of videos about possible pregnancy complications and other possible abnormal ultrasound outcomes. So if you want to subscribe to my channel, make sure to like this video and stay tuned for those. But I would love it if you'd like to lighten the mood a little bit and watch this video about some common pregnancy myths. It's pretty fun. You've probably heard a few of them, but not everything in pregnancy is scary. Definitely some fun things as well. So check out that video. Stay healthy, everybody.